Our ladies and other gentlemen, good afternoon. First of all, I congratulate not only the nursing profession, but all the people who are associated with this profession directly and indirectly on this very important day in the history where the nursing profession had a paradigm shift in from colloquial thinking of nursing profession being a lowly profession. It was traditionally being taken care either by the nuns or the army or security force services. It was when in 1900, medieval times, so at that time people were not actually taking it scientific, or they were not taking it a good profession. Nightingale brought a paradigm change. She made it more scientific, more rational, and gave a flip to this profession. It is not only Nightingale, subsequently several people. It is always one person gets eulogized in history. But there are several people in this, like Gandhi liberated India. He alone didn't do it. There were several people. So I remember the names like Clara Barton, Linda Richards. Similarly, there are several good names who did wonderful work and bringing nursing council in America, what is called American Nursing Association in 1900. When Muslim Conference, Muslim League and RSS was being formulated in India. So they were formulating at that time as American Nursing Association. That means they are at least they were 100 years ahead of us. So what I want to say is that some people took the lead, they dedicated themselves, they must have had a pain. It is not simple. They must have had pain, they must have worked hard, and they brought it to a level. Now if we see today, nursing profession has gone to a great level in the West. And even up to when we were students, very few people were going for the nursing. If you see that when this institute was started, when Kashmir, Sheikh Mohammed Abdullah wanted to take nurses, none of the 12th standard girl would like to go into this profession. And there was a one-time exemption taken from the then Prime Minister Indira Gandhi that PGI should take nurses from this institute for training who are 10th pass. Because 12th pass girl would look for a doctor or a professor or other profession would not come to this. So that was the image of this profession in our society. Now, today you get MBBS and in the same list, just by 0.01 or 0.1 or 1 mark, you go into the nursing or other professions. That means the competition is almost same. And people have started changing the idea that nursing is not a low profession, it is high. But I myself realize that nursing profession is beyond that. I think keeping in view its mandate, keeping in view the service, what they deliver, and keeping in view the comfort level any human being goes. It goes with the Quranic verses. Quranic verse was actually recited here. There are several places in Quran which tell you that if you are good to the creations of Allah, if you are good to general public, means nas, what is called khairun nas man yunfi nas, means you are the elite if you are doing the best for public. And that is what is exactly cling to the nursing profession. जॉब तो जॉब है, प्रोफेशन तो पैसे तो कमाने हैं, रोजी रोटी का सवाल तो है, लेकिन इसमें एक एडिशनल चीज है जो इबादत है। वो हमारे कल्चर, वो हमारे रिलीजन और वो हमारे एथिक्स के साथ भी मेल खाता है। एंड I feel when I joined as a director or otherwise also, when you get a place, age is not which gives you maturity. It is the responsibility which gives you maturity. That's what I feel. You may age, you may be 90 years. If you do not take any responsibility, you will never become wise. So it is the responsibility when it comes to your shoulders. God forbid if there is a small boy or girl who becomes orphan at 10 years of age, you see their wisdom. They start actually taking the shouldering the responsibility, and they become wise. So it is not me that I am wise, it is the responsibility which I take very seriously. I take it religiously. I have told you earlier, when I took over, I changed the direction of table towards Qibla, because I think whatever I am doing is ibadah. And when I started doing review of each department one by one, I did several other reviews, and one of the departments was review of the nursing and our paramedical staff. It pained me. I did not sleep that day when I found that for 10 years there was no promotion. And when I came to know 14 years, 20 years. Okay. So it means when they have entered, they have not been promoted. So they have been stagnant. Then I also saw it is not only nursing, other paramedics had similar problem. The first was that I did not see there was a single officer position in nursing administration filled. Nursing superintendent vacant, deputy nursing superintendent vacant, joint nursing superintendent vacant, other nursing superintendent, there are so many of them. All the cadre is even today vacant. Even nursing supervisor vacant. What is there? Only junior and senior nurses. Out of 391 nurses which I saw, even their promotion plan, which means their even seniority list was not there. So that pained me, and which made me to talk to Madam Indu multiple times. I spoke to the government, I went to all offices and tried to see how we can circumvent this issue. Because I think you have 3-4 things to be done for having a job satisfaction. One, you are nicely paid, I know that. Nurses of these places well paid than nurses at other places. Some nurses wanted to go to GMC Jammu, and they wanted to do an exchange that somebody would come here. When they came to know their pay will drastically go down, they said, no, we are not doing it. So pay is there, but beyond pay, there are certain things that you need to have job satisfaction. You have to remove monotony in your career. What that monotony is that your kids are asking, Madam, Mama, what are you now? You say, I'm still junior nurse. Mama, what are you now? I'm still junior nurse. So that actually demotivates you, I know, I'm sure. So that is why we took a fast track decision. I got approval from government, despite of all the odds, and we have done in the history of Institute, the largest DPC, means Departmental Promotion Committee this time. I had asked the Health Minister, Ma'am Sikinaji, to be there. I thought we will give promotion honors to all of you, but I think you need a Havan and Niyaz or something, because the war came. When I was about to give them orders, so war came. Then they said Nursing Day is to be celebrated. I said, let us not celebrate it. let us do what is called disaster preparedness of nurses. That is what Ashraf told me. I thought it will not look like nice when people are dying on the border and we are supposed to do mock drills. We will not celebrate. Let us give a fillip to celebration. Let us do disaster nursing, augmentation program as well as capacity building, and that is what today is actually happening. That is why we did not get the orders. Otherwise, we were thinking that we were out of 392 nurses, I think 385 or 86 will be given orders soon. So what I feel, I think there is a day coming in this week, Saturday, which is 17th. 17th is International, I think, Hospital Day or something like that. So let us have a program on that day, that hospital